Hello, thank you for joining us for Unite for Sight's webinar about research and advocacy initiatives to curb the health impacts of environmental contaminants. We are thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and chief executive officer of Unite for Sight. I will start by briefly introducing you to Unite for Sight, then review the webinar logistics, and then we will hear from our 5 expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all. And we offer extensive global health and social entrepreneurship education programs, including today's webinar, which is part of our Global Health University program. We also offer 20 online certificate programs for students and professionals, and many students receive academic credits for completion of these certificates. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in environmental health, as well as 17 other certificate programs as well. We have more upcoming webinars during January and beyond, and we encourage you to register for these upcoming webinars on our website at uniteforsight.org/webinars. And several upcoming topics include making the most of an international experience on January 19th, another on January 25th about learning from innovation experts, and then we have another planned on March 24th regarding perfecting the pitch. Additional educational opportunities for students and professionals also includes participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. And our 13th annual Global Health and Innovation Conference, which is the world's largest global health conference and social entrepreneurship conference, will be held on April 16th and 17th, 2016 at Yale University. So save the date, and the conference website as well as abstract submissions and registration details can be seen at uniteforsight.org/conference. And the conference also includes our 2nd annual GHIC Innovation Prize, which is a $10,000 and a $2,000 cash prize, so 2 different cash prizes to the 2 best pitch presentations at the Global Health and Innovation Conference. And the prize supports outstanding ideas, programs, and organizations which are locally developed and locally responsible. December 31st is the next application deadline for any who are interested in learning more details about the Innovation Prize. And we also have healthcare delivery programs that provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and managed by the local medical professionals. And our collaboration with the local doctors has provided eye care to more than 2 million people during the past decade, including more than 90,000 sight-restoring surgeries by the local ophthalmologists. And Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. And we have participants who support and learn from the local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty. So now I'll describe the basic logistics of this webinar. We're so delighted to have all of you with us here today. We have 5 incredible panelists, and they have a wealth of expertise to share with you during this next hour. Each of the 5 panelists today will start by giving a 2-minute introduction about themselves, their current role, and their key lesson learned about environmental health. And then we will dedicate the remaining time to your questions and answers. And we received many excellent questions already submitted from you, our audience, by Monday's question submission deadline. And we selected the most common and most thoughtful questions to ask our panelists. We also invite you to submit additional questions today in the text box on the left of your webinar screen, and then we'll select additional questions from those to ask the panelists today as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GH, and you can see that hashtag in the webinar visuals on your screen. Now we will proceed with having our panelists introduce themselves in alphabetical order, and I'm delighted to introduce you to our first panelist, Gary Cohen. Gary, if you can please introduce yourself, your background and current role, and please share your key guidance related to environmental health and research and advocacy.
Thanks, Jennifer. My name is Gary Cohen. I am the President and CEO of Healthcare Without Harm, which is a global organization working to make the healthcare sector environmentally responsible and to activate health professionals as advocates for environmental health and justice around the world. I studied philosophy, Western philosophy and then Eastern philosophy in university, and have been involved in issues around environmental sustainability and toxic chemicals for about 30 years. I would say the three important lessons that I have learned is, one, that medicine and public health, those sectors, have not understood the connection between the environment and human health and how critical that is to the health of people and communities on the planet. So it creates an enormous opportunity for mobilization, for education, for activation of those sectors. Second thing I've learned is that the issue of a toxic chemical and health is fundamentally an issue of human rights and of toxic trespass, which goes all the way into trespass into the womb and trespass into our bodies. And the industry, the chemical industry in particular, frames it as an issue of that low doses of chemicals don't matter, and all the science is telling us that low doses of chemicals at a very early stage of development, including in the womb in the first 1,000 days of life, is absolutely critical to the health of the developing person. And then the third thing, quickly, is that I've learned that policy will not save us. It is incredibly difficult to pass policy. The industry, the fossil fuel industry, the chemical industry, the big ag industries have enormous power. And if we can not just put all of our eggs in the policy basket, but also to use the marketplace to drive procurement changes as another way of achieving policy in key sectors, in key institutional leaders like hospitals and health systems, we can achieve much faster change in the way that chemicals and fossil fuels and other things are regulated in our society.
Excellent. Thank you so much, Gary. And Avery, if you can also please introduce yourself.
Hi, my name is Avery Lindmann. I'm the Deputy Director of the Green Science Policy Institute, which is a nonprofit located in Berkeley, California. Green Science Policy's main mission is to facilitate more responsible use of chemicals, and that's in consumer products and building products and elsewhere. And we particularly focus on bringing good science to various stakeholders, including government, other academics, NGOs, industry, and the media, to develop solutions for safer products. My own background is in chemistry. I have a bachelor's in chemistry from Harvard University and a master's in chemistry from UC Berkeley. And I've been with Green Science Policy for about 2.5 years now. And I would say our belief in terms of how policy can drive safer use of chemicals for a healthier environment is that many policies can have inadvertent or unexpected impacts on human and environmental health. For instance, we've done a lot of work around flammability standards, which on the surface might seem completely irrelevant to public health, but they've had huge public health implications. And so it's really important to bring in a diverse group of stakeholders with different expertise to evaluate policies, even when they don't necessarily on the surface look like public health policies. And we also believe that with a common understanding of good science, policies can be improved. And with diverse stakeholders, we can more quickly make informed improvements, both legal and regulatory, and also voluntary policies like Gary was talking about with purchasing.
Terrific. Thank you so much, Avery. And Keeve, please introduce yourself as well.
Sure. Thank you, Jennifer. Can you hear me?
I can, yes.
Okay. Hello, everybody. My name is Keeve Nachman. I'm an assistant professor in the Department of Environmental Health Sciences and Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. I also wear 2 other hats. First, I direct the Food Production and Public Health Program at the Johns Hopkins Center for a Livable Future, or CLF for short. And CLF is an academic center actively engaged in food system research, advocacy, communication, and education. I also co-direct the Johns Hopkins Risk Sciences and Public Policy Institute, which is dedicated to the protection of public health through education, service, and research in risk policy. We provide scientists and decision makers with the tools necessary to ensure that the environmental health policies that we put in place result in improved public health. A lot of my current work focuses a great deal on the practices implemented in the production of food and how those practices may lead to or maybe help minimize exposures to chemical and microbiological contaminants in food and the environment. I have a little bit of an unusual background. When I started college, I couldn't decide between becoming a writer or being a doctor, so I tried to do both, and that didn't really work out as planned. I ended up graduating with a writing degree and a handful of science courses under my belt. After that, I followed my undergrad experience by getting a master's degree in radiation health sciences and medical physics, and then went on to study environmental health policy and the risk sciences for my doctoral training. I graduated and worked at the Environmental Protection Agency and the Department of Defense as a risk assessor and toxicologist. Afterwards, I came back to Johns Hopkins to focus on food system work and risk assessment at the CLM. I've been really lucky to have terrific mentors throughout my career, and one common thread among them is a passion for public health practice and evidence-based advocacy. Under their guidance and through my own experiences as well, I've learned that the role of a public health scientist ideally should really extend far beyond the bench. It's sadly not uncommon for a scientist to believe his or her job is finished when the research finally finds its way into a journal. I've always taken issue with that sentiment, and have expended a lot of effort to make sure that the findings of my work are used in a wide array of different audiences in pursuit of public health policy. These efforts have taken a number of different shapes, from advising politicians to speaking with the media to engaging with regulators in the rulemaking process, and even to working with communities to help translate our research into steps that can be taken to reduce risks from exposure. These experiences have made very clear to me that research translation into an accessible and usable format is really requisite, and it's also a really rewarding pursuit. I'm looking forward to the Q&A, and thanks for having me.
Thank you so much, Keeve. And Peter, if you can also please introduce yourself.
Thank you, Jennifer, and hello, everyone. So my name is Peter Rabinowitz. I'm an associate professor at the University of Washington in the Schools of Public Health and the School of Medicine. And I am a physician who trained in originally primary care and family medicine, and one of my first experiences in family medicine was working in my hospital in California, where we served a lot of migrant farm workers, and one of the diseases we were treating in the farm workers was pesticide poisonings, where many times a number of people would come into the emergency room at the same time having been exposed to toxic pesticides. And one of the things that I was struck by was, first of all, how very little in my medical training had prepared me to really work with toxic exposures. It was not something that the average physician gets a lot of training in, and it really reminded me of the importance of chemicals and environmental exposures on people's health. So I finished my training and started working and practicing in family medicine. And as I was seeing patients, I had a sense that the environment was important, but it was hard sometimes to bring that into the medical setting and understand what kind of environments they were exposed to and how that was affecting their health. So I went back and got specialized training in a field called Occupational and Environmental Medicine, which is one of the medical specialties, and it's really the specialty that tries to look at things in the environment and the workplace that can be making people sick, from asbestos to lead to pesticides to infections that could be making people sick, and then what to do about it. And as I was doing that, I was both getting involved in some research as well as seeing patients, and I had a clinic in this at Yale where we saw people who could be exposed to chemicals in their work, or they could be exposed to chemicals in their environment. And one thing that I saw was that some people are exposed to very high levels of chemicals, such as if they're working in a factory, and some people are exposed to very low levels of chemicals, and that people are very different about how much they perceive the risk from the chemicals, and that sometimes there would be an incredible amount of concern over exposures that were low as compared to another person exposed to the same chemical but a much higher dose, and that I saw some people because they weren't quite sure how much risk they were in, becoming incredibly anxious about their environmental exposures and even being scared to leave the house for being concerned about being exposed to a chemical and the risks of there. So it reminded me that we live in a society with lots of risks, and we do have to try to understand what risks are really huge and which ones are smaller and which ones we're going to do something about on a daily basis so we don't become immobilized, but that we also really remain active dealing with the very important risks. So that's one lesson I would keep in mind here. How big is the risk and what are we going to do about it, and how do we keep from being immobilized by concern about the risk and focus on what we can really do? And the other thing about my work in research is that I started looking at how to understand what things in the environment are bad or not. Much of what we know about are based either on studies of people who have been exposed in some inadvertent way to some chemicals, and we try to study them and understand what effects they're seeing. And then there's been laboratory studies, often very short, high-dose exposures with laboratory animals, and I felt that really doesn't give the whole picture. And as I was reading the scientific literature, I was finding all these reports of things out in nature with wildlife and cows and dogs in houses, and how animals sometimes can tell us about exposures in the environment that can be important to our health as well. And that led to me to get more involved in this field called One Health, where we try to understand the environment that both people and animals are sharing at any one time, and many times the animals are more exposed to whatever's in the environment than we are, and we want to be able to detect if the animals are getting sick. They're like the canary in the coal mine and can tell us important things about our own health. So now I direct a center at the University of Washington called the Center for One Health Research, where we're looking at particular hazards in the environment, and we're trying to look at what's happening both to the people but also the ecosystem and the animals that are out there as well, and so that we're trying to work toward healthier environments for all species. So I'll stop there and look forward to questions.
Terrific. Thank you so much, Peter. And Linda Weinstein, if you can also please introduce yourself.
Sure, and Jennifer, thank you for pulling this webinar together. It's really exciting to be here. So I'm Linda Weinstein, the co-founder of the Asbestos Disease Awareness Organization, ADAO, and we're an independent nonprofit dedicated to eliminating the preventable asbestos-caused cancers and, of course, the respiratory diseases. Well, like most Americans, I'd never heard about the dangers of asbestos and trusted our government kept us safe from toxins. And our world of knowledge changed instantly when Alan, my husband, was diagnosed with mesothelioma in 2003, and our daughter at the time was just 10. And Alan fought a courageous battle for 3 years, and Emily and I held his hands as he took his last breath. And this gives me the opportunity to look back on the past 12 years and, share lessons learned. And like many of the panelists already, we recognize policy and the inefficiencies and the need for other actions. I have been working with Congress, federal agencies, United Nations, international governments, and, of course, trade unions, just to raise awareness about asbestos in homes, schools, workplaces, consumer products, and our environment. While we call for a legislative ban, there's this misconception that asbestos actually had been banned and no longer is a threat to anyone. So some of the lessons that I've learned while I've been trying to end this man-made disaster with so many others, it really feels like a David and Goliath battle, are that we have to invest time and resources in prevention. We know that there's promising research for cancer and other diseases, but prevention for now remains the only cure. The impactful side of storytelling is something that really, we're talking about 100-year-old connection between asbestos and disease that we're trying to obviously it's the ultimate big tobacco playbook, and we're up against big money, is that don't underestimate the power of storytelling, sharing ours and also each other's. We share it with obviously online and Congress and the media, and we've had to reshape this conversation to draw media attention and obviously constituency pressure to ultimately work towards a ban. Clearly, unleashing the power of social media for us has been huge. We were founded during the time of Google and Facebook, and that is the way that we can maximize our voice and visibility in efforts to shape policy and, of course, enforce existing laws. But I think this webinar for me, Jennifer, really accentuates the need for engagement and collaboration. They're absolutely essential when we're trying to protect health and our environment, because organizations cannot do this alone. It requires all of us. So that's a bit about me, and I too look forward to the questions during this webinar.
Excellent. Thank you so much, Linda, and thank you to all of our panelists. As you heard, they have a great wealth of expertise and guidance to share with you today. And now we will proceed with the question and answer session. As mentioned, we received questions in advance from you, our audience members, but if you have additional questions, please post them in the text box on the left of your webinar screen, and we will add those to the webinar today as well. And to begin for our first question, Peter, what do you think is the greatest environmental concern for human health?
That's a great question and not an easy one. The way I would answer that is that I think the greatest environmental concern is that our human population is increasing up to 9 billion people. And with it, we're also increasing the number of animals that are being raised for food and animal food production in terms of chickens, which are increasing much faster than the human population, as well as pigs and other animals. So we now have a lot more people and a lot more animals on the planet, and that means almost everything we do potentially releases some toxic things into the environment that we then have to deal with. And one of those problems is the release of so much waste from both humans and animals that have in it not only a number of chemicals related just to manure and those kind of nitrate chemicals and things like that, but also all the chemicals that we take in our body in medications often ends up in the sewage that we produce. And so I think we have to realize that we have a limited Earth and a lot of people and a lot of animals, and we have to get much better at cleaning up our mess, basically.
Great. Thank you, Peter. And Keeve, what are the 3 most important improvements needed for the current food system?
Thanks for the question, and I think Peter hit on one of those, and I'll certainly come back to that. There are a lot of priorities in terms of improvements that we really need to fix our food system, and it's really challenging to pick 3, but I'll give you 3 that keep me up at night. The first one's especially relevant for me. I'm on my way right now to a conference to discuss it, but I think we need to eliminate the use of antibiotics in animal agriculture for non-therapeutic purposes. I think a lot of people are starting to become more and more aware of this now, but we, in many cases, use the same antibiotics that we rely on in human medicine for treatment of infections for purposes other than treating those infections in animals. Just in the U.S., if you were to look at the relative fraction of antibiotics sold each year going into animals, it's somewhere between 70 and 80%. And the way that those drugs are used in animals are far riskier in terms of promoting and propagating antibiotic-resistant bacteria than they are in people. So I think there's a very, very clear rationale and a very real human risk of resistant infection that arises from the nature of the uses of those drugs. So that would be a top priority for me. I think another and sort of a different domain within the food system would be to tackle the barriers to food security. And by this, I really mean that we need to not only make healthy, safe, affordable, and culturally relevant foods available to everyone, but we need to be thinking about some of the other factors in the equation, too. We need to be sure that people really have the knowledge and resources to prepare their own food. There are a lot of things that can get in the way of preparing healthy food for oneself and one's family, like time, knowing how to cook. It's something that's not as readily available anymore as it used to. And even, the cooking supplies needed are not something that we can assume everyone has. So in addition to making safe and healthy food available, we got to give people what they need to prepare it. And lastly, this gets back to what Peter was saying too. We do have a lot of people on the planet. We do raise an enormous number of food animals, and I think there's certain parts of the world, especially the ones that are developing very rapidly, their hunger for meat is increasing at a very rapid pace. And I think we've learned that we need to move away from a meat-centric diet towards one that's more plant-based. And that's really not only considering some of the planetary considerations, but also for our own health, too. There's good evidence that one's health is dramatically improved by avoiding certain types of meat in the diet. So I think those are the 3 that I would nail down as the top priorities. Very challenging ones to tackle, though.
Wonderful. Thank you so much, Keeve. And Gary, how do you institutions such as hospitals to change their environmental policies?
Well, the healthcare sector is a unique sector in that they are sort of bound by this Hippocratic oath to do no harm. So they can't really be exposing their patients and their employees and the larger community to fossil fuels, to toxic chemicals, to industrial waste, and say, well, that's just the price of progress, because their mission is to heal. And what we've done is to say your mission is not only to heal individuals, but it's to heal communities and to heal the planet because of how critical the environment is to people's health. And so we've gotten them to understand that they are significant polluters because they're an industrial enterprise, especially in the developed countries, just like the rest of the economy that's dependent on fossil fuels and toxic chemicals and industrial agriculture, and have appealed to that mission and shown them that if they make changes in their waste practices to eliminate incineration, to eliminate mercury as a measuring device, to in fact only buy meat produced without antibiotics, to get rid of toxic chemicals from their supply chain, that's good for their mission. In most cases, it saves them money, so it's good economically. And it also is, in many cases, good for patients and employees and larger community health goals. And the thing that we're especially focused on now is we think that climate change is the greatest public health threat of our lifetime and of our kids' lifetime. And getting the healthcare sector to lead by moving toward renewable energy and low carbon strategies and showing the rest of society how that can be done and how to rebrand climate change to be a public health imperative to address is a big focus. And we're having a lot of success in having them expand their mission to that larger healing transformation that needs to happen on the planet.
Wonderful. Thank you, Gary. And Avery, what is being done at the policy level to reduce contaminants within the environment, and what do you see as the role of social movements to change the status quo?
Thank you for the question. Yeah, there's a lot going on at both the national level, the state and local level, and also in terms of voluntary policies to try to reduce harmful chemicals in the environment and in people. One aspect of that in California, for instance, is the Department of Toxic Substances Safer Consumer Products Regulations, which one by one is selecting common products with chemicals of concern and basically requiring manufacturers of those products to come up with inherently lower hazard solutions for providing the same product or the same functionality without harmful chemicals. Unfortunately, the scale of that is not tremendously large, but California has a lot of influence on the rest of the country. And the fact that that program is underway and they've listed potential products that they might target in the future, I think is causing manufacturers whose products have not yet been identified to start considering what's in the products they're selling and gradually work towards lower hazard components. Of course, there are a lot of legislative attempts and successful ones at banning or restricting the use of known harmful chemicals. And these can be really effective in essentially forcing manufacturers to stop using chemicals that we know are harmful. They're often difficult to pass unless manufacturers are voluntarily ceasing to use the chemicals in the first place. But they're also useful drivers of companies' chemical policies. And then the third major area where I think a lot of work has been done and I think is a growing area of focus in terms of policies is voluntary purchasing policies. And Gary touched on this a little bit, but major purchasers, major organizations that buy a lot of products from manufacturers have a lot of power because of the amount of dollars that they're spending. And so there is a lot of movement for major purchasers as well as state and government organizations that make a lot of purchasing decisions to basically use that buying power to demand from manufacturers inherently safer products. There is certainly a role for the average consumer that goes to the store and essentially votes with their own dollars on what kinds of products they want, to also tell companies that they want safer products, that they want products that aren't going to lead to unnecessary environmental contamination or unintended health harm. And so this is challenging. Certainly a social movement is needed because it's not necessarily something the average consumer has time to think about or necessarily has the bandwidth to think about. And one of the challenges is how can we get society as a whole to make more responsible decisions at the grocery store? How can we get them to vote with their own dollars to encourage manufacturers to use safer chemicals?
Terrific. Thank you, Avery. And Linda, are laws in place to protect human health from environmental contaminants? And what is the best way to protect the public from known environmental contaminants?
Well, those two great questions. I think most Americans assume that everything is protected. Their food, their air, their soil is free of contaminants, and clearly we on this discussion know that that's not true. So yes, we have laws in place, but they all must be strengthened and, most importantly, enforced. I mean, if you just look at asbestos as one carcinogen, it still remains the biggest workplace killer ever, and that's just unacceptable in our country. When we talk about laws in place to protect, obviously, human health and our environment, one of the best examples of the laws that you'd want to look at would be the Toxic Substances Control Act of 1976, which is obviously outdated and horrifically weak. And if looking back at history, this law couldn't even ban asbestos. Now, we face a new challenge in Washington today. There's a new so-called TSCA reform bill on the desks in the House and Senate, and it's actually written by the chemical industry, and it's even worse than current law. So although, yes, we have laws in place, enforcing them is important, and I think in remaining vigilant to oppress the chemical industry's power and dollar, because we as Americans are going to have to take an active role in prevention. We have to know what and where the common environmental contaminants are in our home, community, and workplaces. And, of course, what's the best practice for prevention? So we also have to take a responsibility in reducing chemical exposure.
Excellent. Thank you so much, Linda. And Peter, though lead is known to have significant health implications, it continues to be used and found in products such as children's toys, plates, and other eating surfaces, etc. Schools and homes built prior to 1978 in the U.S. frequently have significant lead hazards, and lead paint is still used in many countries today throughout the world. What has enabled lead to remain prevalent despite knowing for decades about the health implications?
Well, it's a good question. So there's some good news and some bad news. As you said, they have banned lead from certain things in the United States, including in the indoor paint for houses since 1978, as well as lead in gasoline. And just so you know, the news is not all bad. When they look at the blood lead levels of children in the United States, they've actually been declining over the last 20 or 30 years since doing these regulations, so that it shows that regulations can work and that you can actually reduce the rate of lead in children. At the same time, research, as we get better at research, we find that levels that we used to think were safe now are probably not so safe, and that even at levels very, very low, because lead is not a natural thing to have in your body, and it really is something that hurts your nerve cells, especially if you have a developing brain, we do see that children exposed to even fairly low levels of lead that we used to not take for, that much of the population used to be exposed to, even at this very low level, there are still probably effects on the brain. So we've still got a ways to go. In terms of why it's still In other countries, you may have less regulation than in this country. The reasons why we still use it in some things is that we pass a law to regulate it in gasoline, but we didn't regulate it in, say, fishing equipment. So you go fishing and you use lead weights, whereas and also shooting, we still use lead in bullets. And one of the reasons why it's used is that there's a reason, over hundreds and hundreds of years, somebody decided that lead was the best metal to make a bullet out of, or a fishing weight, or a particular type of glass. And then when the industry then has to change, just like they've pushed back about reducing or improving the amount of mileage you get in your car per gallon of gas. They've sometimes said, there's no way we can really make good bullets or whatever without using lead, and so sometimes there's still a little bit of allowed, and so there's sometimes a trade-off between how much it costs to make a substitute and how well that substitute works compared to lead. And somewhere somebody is saying, well, it's okay if there's a little bit of lead in the environment because it's such a cheaper way to make something, and there's an economic balance against some health risk. And we have to be very careful who's making those decisions, and are they making the right decisions, and how do you look at how this kind of thing then builds up in the environment, whether it's birds that are getting killed from lead accumulating in water, in ponds and lakes and waterways where the birds are concentrating it in their bodies. So just because we've regulated it in one place doesn't mean we're keeping it from concentrating in another place. So I'd say the reasons that it's around the world still are partly economic and partly related to industry and feasibility and in inconsistent regulations. And we still need to learn more about the low levels of this thing and keep trying to reduce it, but also make sure that the substitutes we bring in are not worse, because many times we've taken a certain chemical, substituted another chemical, and ended up with a new set of risks that we don't even know about until much later. So we have to always think of the problem you have versus the problem you might have if you substitute.
Excellent. Thank you so much, Peter. And Avery, what is the media's role in allowing environmental contaminants and also in working to change policies? For example, it wasn't until the Chicago Tribune published an article about flame retardants in pajamas that a longstanding policy in California was ultimately overhauled. For those interested in changing policies, how can they work to engage the media?
That is a really great question. And I'm glad that whoever asked this is aware of the Chicago Tribune series, because for those familiar with the flame retardant work, that series of articles in the Chicago Tribune was instrumental in changing California policy and enabling a number of barriers to fall down to allow reduced use of flame retardants in furniture throughout the United States. So the media can be tremendously powerful in a number of ways. One, as I mentioned already, it can be difficult to communicate about harmful chemicals in consumer products to the general public. It's a fairly complex issue. It's an added thing that people may not have the bandwidth to worry about, and it's not necessarily a topic which is easy to engage people who aren't chemists or people who aren't in public health or other technical fields to think about. And the media can find interesting angles. They can communicate about a lot of technical policies, about scientific findings, which the academics or the people involved in the policy making might not be able to present that in a way that's actually interesting to the general public. So that's one way. Another is that by bringing major attention to these issues, the media can sort of create openings for policymakers or for companies to change their own, to make changes in legislation or to change voluntary company policies in a way that without that media coverage, it would be more difficult to justify. The media kind of provides a cover, maybe an entree to making a change. For instance, in California, the Chicago Tribune series raised awareness and also brought to light some scientific findings, which made it much easier for the state government to begin working on the issue of furniture flammability. For those interested the last of this question for those interested, how can they work to engage the media? What we do at Green Science Policy is we try to share recent findings with contacts that we have in press, basically just to keep the media posted. I think now, depending on where you work and the kind of work you're doing, social media can also be an important way to let reporters know interesting things that are going on that they might want to report about. And I think something important to keep in mind is that it doesn't always happen right away. So often these relationships with media take time to build, and also, depending on what you're working on, it might take time to get to the point where media feels like they know enough and is interested enough in your issue to cover it. But it's definitely worth the time. I don't know if any of the other panelists would like to add to that.
Sure, this is Keeve. I guess I'll just say that, in my work, I've found it really important to develop relationships with reporters. And, as an academic publishing research, if I know that I'm coming out with a paper that could be of public interest, especially in light of influencing the public maybe to support a policy change, sometimes dropping a note to a reporter ahead of time and having a conversation could lead to some nice coverage that really gets the word out about an issue. So I think we have a lot to gain from engaging reporters.
I agree with both of you. The media for us has been essential. Maintaining that relationship, but also being that credible resource that they can tap into when they're on deadline has helped us to maintain a visible spot and really remain a stakeholder in legislative discussions, but also public health advocacy issues and actions.
And this is Peter Rabinowitz. One thing I've found about the challenge of visibility and things is that there's so much media and so much social media and traditional media that the public is bombarded all the time, and so you have to get your word out at one point, but then you have to consider continuing to get the word out because everybody's attention span is so short that there's so many things people are focusing on that you have to continue to keep something in the public eye.
This is Gary. I would bring a couple other dimensions into the conversation. It's also really important who the messenger is. And so in our society, in most societies, health professionals are some of the most respected messengers in society. And so getting doctors and nurses and public health people talking about why we need policies to eliminate the overuse of antibiotics in animal agriculture, why we need policy to phase out toxic chemicals, why we need policies to rein in climate change. The health sector and health professionals are critical messengers, which is why when President Obama released his climate action plan, he did it with, in a school with kids talking about asthma and an event with the American Lung Association. When you think about the enormous number of Americans who are involved in various also disease groups, whether that's asbestos or cancer groups or infertility groups or learning disabilities groups or heart disease, there's links with all of those diseases and the environment. And we've spent so much kind of public capital looking for the cure for cancer, focusing on the cure. And if we could move all of those people, tens of millions of people upstream to start addressing the environmental and social issues that are contributing to that epidemic of disease in our society, we have an army of people working to heal our society.
Well, when we talk about the media, for us, because it's an international issue with asbestos, mining still continues. Russia mines about 1 million tons a year, 2 million globally, and the death rate is huge. It's 107,000 people die every year, says the World Health Organization. So we have found that graphics through our storytelling and informational brochures have worked well to cross all lines of language, easily shared, understood, and remembered. So when working with the media, we really try to accentuate the graphics behind the message or the paper that we're writing an issue. It seems to help in global sharing and also remembrance and moving forward.
Wonderful. Thank you so much, Linda. And a question for Keeve. Farmers can buy many antibiotics for their livestock without a veterinary prescription. With antimicrobial resistance on the rise, what should the approach be to changing behaviors of the industrialized agriculture community?
That's a great question. Okay, so one thing to note is that the ability of farmers to buy antibiotics over the counter is changing. In the next few years, that won't be allowed, but unfortunately, it's not going to truly address the problem. The real issue is that for certain sectors of the animal production industry, particularly the poultry and swine industries, those industries are something we call vertically integrated. They're controlled by the large companies whose names you would likely recognize. And they have veterinarians working for them that are responsible for making decisions about what goes into animal feed. So the people you might think of as farmers, the people who run the operations where the animals are raised, they're not the ones making decision about the feed or buying the feed with drugs in it. So unfortunately, that change from over-the-counter to prescription only or what they call a veterinary feed directive is not going to make as big of a dent in misuse. The FDA, over the past couple of years, has implemented a plan to ask drug companies to stop selling drugs for things like growth promotion, which sounds good. The only problem is that they're continuing to allow those drug manufacturers to sell antibiotics for something called disease prevention. To the untrained ear, disease prevention sounds okay. Who doesn't want to prevent disease? But unfortunately, in the context of using these drugs, disease prevention is really an inappropriate and non-therapeutic use of those drugs. So despite all of these plans put in place by FDA, nothing is working. There have been some very high-profile national commissions put together over the last couple of years that have aimed at trying to make recommendations for how to curb misuse, but sadly they haven't had a very meaningful impact on the state of practice. And to make things even worse, we really aren't tracking use in a meaningful way that would allow us to even evaluate whether changes that need to be made have been made. So it's sort of a dire scenario, and in light of some of the things we're hearing out of China and Denmark with genes that confer resistance to polymyxin antibiotics, which are our antibiotics of last resort, this is becoming even more and more of an urgent crisis.
Thank you so much, Keeve. And Peter, a question for you. In Texas, we're seeing many pediatric deformities and developmental delays, and looking into what percentage of these are due to environmental or occupational health hazards. How would you suggest that medical professionals intervene in such a politically contentious issue?
So this is a question where sometimes we observe unusual things happening and want to sort of understand why, and if they don't seem to be an obvious reason about a medication that all these people took to cause the birth defects, how do we look for something in the environment that could be doing it? And there's challenges to doing that because people move around and they don't always tell you everything that they've been eating or that they've been exposed to. But it's very important to do careful studies at that point and to not only ask people a lot of questions, but to do some biomonitoring, to really do measurements of what's in their blood and their urine and see if we can compare people with healthy babies to people without healthy babies, and make some important conclusions, because sometimes, unfortunately, the way we find out about problems with a particular chemical is when something bad happens that we don't understand. It would be nice if no chemical was used before we had totally tested it. And what I think the public and scientific community should know as well is that most chemicals out in use, there's tens of thousands of chemicals in use on a regular basis, most of which we really have not tested extensively for safety. And then, as some of the other panelists have said, we don't always know what low levels of these, sometimes in combination, do. And also, when you release a chemical into the environment, it can be degraded by sunlight and heat to have certain metabolites that may be actually different in action than what the parent chemical was. So sometimes we want to test as many chemicals as we can and things before they're used, but no matter what, when something strange starts happening, like birth defects in Texas, we need to do careful studies and try to figure out what's going on as quickly as possible and do good ones. And I think then what I was going to add was that the same is true when we see weird things happening in animal populations. And so we have seen strange reproductive effects in whales, in alligators, in seabirds, and some types of animals that are often able to concentrate chemicals in their body and also show reproductive effects quicker than people sometimes because they tend to have more offspring quicker. So we need to be looking not just at strange things in people, but strange things happening in animals too if we're going to pick up some of these effects of both particular chemicals as well as chemical mixtures in the environment.
Terrific. Thank you so much, Peter. And Keeve, what is the role of research and how can it be applied to policy?
Sure, that's a great question. I don't really look at research and policy as a one-way relationship. Research is a great way to answer questions. And in a lot of cases, these questions may arise in the context of a policy debate. And so a lot of my research focus has really been driven by policy needs. I'll give you an example. I spent the early part of my career working on a drug that's used in animals called roxarsone that contains the chemical arsenic, which is a well-recognized human carcinogen. I initially started focusing on how when that drug is used, arsenic accumulates in the waste of the animal, which then is spread on agricultural land as fertilizer and can potentially lead to really sizable increases in arsenic in the groundwater that's then used by people as drinking water. I thought by characterizing the extent to which that happens, we'd be able to move policy forward. And I learned firsthand and somewhat painfully that environmental exposures in some cases are really not enough for stories of environmental exposures to push policy forward. And what became clear to me during that policy debate was that people were far more interested in whether a fraction of the arsenic that's fed to chickens accumulates in the meat in a form that's toxic to humans. And so I shifted my focus then from looking at manure, groundwater, and drinking water to really looking at exposures that may occur through the diet. We published a study in 2012 that showed that, in fact, when you use this drug, you do see increases in the meat. And shortly after that study was used by a peer group, the Institute for Agriculture and Trade Policy, in collaboration with the Center for Food Safety, in a lawsuit to sue the FDA over the approval of that drug. And that study was really the missing piece of what they needed to be successful with their lawsuit. And since then, the drug has been withdrawn. So and that's just one example of where, it may not have necessarily been where I would have focused my research given my perception of where the greatest impact of the problem may have been, but it was the policy need, it was the gap that was needed for the regulators to move forward, and so that's what we provided. So I think there are probably lots of other examples out there where research is really driven by a societal or policy need.
Terrific. Thank you so much, Keeve. And Gary, how do you distill and communicate complex research results to the public?
Yeah, it's a great question, Jennifer. We've focused at Healthcare Without Harm on, first of all, showing that people are being exposed against their knowledge and against their consent to toxic chemicals, in some cases in the medical setting. So one is to talk about that they're being exposed. So, for example, in PVC ID bags, it includes a class of chemicals called phthalates. So they're actually, when you get your IV drip from PVC ID bags, it's actually dripping a reproductive toxin into your blood. And so vulnerable patients, kids in a neonatal intensive care unit, pregnant women, other patients, it's crazy to expose vulnerable patients to a reproductive toxin. So there's the issue of exposure, and then there's the issue of risk. Well, this is a chemical that's dangerous. The third is to say, well, it doesn't have to be this way. There are safer alternatives on the market, or should be developed. In this case, there were on the market where you could get your IV bag and your fluids without this chemical. And then they're cost competitive, as it turns out. And then there's the values that, we shouldn't be exposing people, whether it's farm workers or patients or moms or kids or anybody, to toxic chemicals unnecessarily. I mean, people don't realize, because they're mostly invisible, they don't realize the level of toxic trespass that exists in our society that's unnecessary. It's because industry has not only polluted the environment and our bodies, but they've also polluted our democracy. And why it's so difficult to pass legislation on chemicals or asbestos or fossil fuels or antibiotics is because large-scale industries, help to control our democracy and our Congress, which is why it's easier to pass things at a local level. It's harder, but still possible to pass things at a state level, as our colleagues did. Avery talked about around the flame retardants. But as you get up to the national level, as you get to the international level, it gets more and more difficult. So you need social movements. You need good media. You need good science. You need good alternatives. You need good economics to win these kind of issues. And you also need to split the industry. All industry is not created equal. So the fossil fuel industry and the chemical industry, they're at the top of the food chain. And there's many, many, many companies that are lower down on the food chain, in the supply chain, for which they don't inherently need to use fossil fuels. They don't inherently need to use safer toxic chemicals. If you can show them there's safer alternatives, they'll move in that direction. And I think we're seeing a lot of voluntary policy from large companies, because they know that it's not good for them to have toxic chemicals in their supply chain and exposing people to them.
Wonderful, Gary. Thank you. And Linda, how is asbestos currently used in developing countries, and what are some examples of the documented effects on communities and families?
Yeah, an important question. So for over 100 years, we've known the connection between asbestos exposure and disease. However, in developing countries primarily, it's used in the cement building products. It's still highly profitable, so the merchants of death are quickly peddling their stuff as they can. We see mining and manufacturing continue. And clearly the fact that the U.S. has not banned asbestos sends a bad message to those in developing countries, because it's used as a form of propaganda that if the U.S. hasn't banned asbestos, it clearly must be okay for their countries to use it. The hard data for us is the World Health Organization obviously states there's 107,000 deaths every year. But here at home, there's 15,000 Americans dying every year from preventable lung cancer, mesothelioma, and other diseases. So what we've seen, which is pretty exciting to me, is that there has been such a social movement with trade unions and NGOs to work with the developing countries to give them resources and stamina and support so they can start their own movements at a grassroots level, but also working with the governments to truly pass ban asbestos legislation, which isn't the all-time fix. I mean, it's a step forward. It's like if we don't have a ban in the United States, you can bet crayons and other products are going to continue to be imported and used, which obviously is unacceptable in the U.S. or anywhere else in the world.
Great. Thank you so much, Linda. And Gary, it was not long ago when lead and asbestos were promoted as healthy and effective products. What materials that are widespread today might we similarly realize are harmful, and how can products be tested prior to mass market so as to avoid widespread harm?
Great question. Well, certainly certain kinds of plastic that are so widely used, like PVC, they're toxic throughout their entire life cycle. They create dioxin when they're produced and when they're burned through incineration. And then there's all sorts of toxic chemicals that are used as additives and fillers and softeners in their use. So that kind of worst-in-class plastic is something that would be incredibly helpful to phase out globally. The other that we've come to realize now, and I think there's a building global consensus, is around coal as worst-in-class fossil fuel, which is an enormous contributor to global climate change, but also contributes to heart disease and respiratory diseases all around the world. And so it's got a local pollutant, but also a global pollutant. So I think over the next 5 to 10 years, we have to phase out coal around the world in order to have any hope of reining in climate change. And then I think we'll also realize that, and we are, that right behind coal is we need to move to be phasing out oil and natural gas, and to move to essentially an entirely new economy based on renewable energy.
Terrific. Thank you, Gary. And Avery, do you have any additional thoughts on that question regarding what might we realize in the future that we're using now is actually very harmful?
I think Gary gave a great response, but I would like to touch on something that did come up earlier in the call, which is the issue of regrettable substitution, where something that we know causes harm is removed and replaced with often a very similar chemical that we don't have data on, and down the line we learn that it has been causing problems. And how to avoid regrettable substitutions is a really difficult question. One thing that we're working on at Green Science Policy is considering classes of chemicals of concern, where we've grouped chemicals that have similar properties and or are used for similar purposes, and we're working on replacing those chemicals to avoid that sort of harmful chemical cousin problem. And those classes include flame retardants, halogenated and phosphate flame retardants, halogenated antimicrobials. There are certain chemicals used for stain repellency, and Gary mentioned plastic additives like phthalates, all of which are groups of chemicals, some of which haven't been studied very well, but if we focus on banning very specific chemicals, there is a risk that those harmful ones will be removed and replaced with very similar substances that probably will cause similar harm. And I wanted to add too, the question of how to test chemicals prior to market is a really difficult one, both in terms of time scale and in terms of cost. But something that does deserve a little bit more attention is increasing testing for effects at very low levels. There's a lot of evidence that chemicals can cause developmental and hormone disruption at very low levels, and current testing doesn't necessarily address those possible impacts. And it's a really challenging question, but one that I think does need to be considered moving forward.
Thank you so much, Avery, and thank you so much to all of our phenomenal panelists and all of the expertise that they have shared with us during this webinar today. And this now concludes today's webinar. Thank you to all of our audience members and panelists.